Good morning, everyone. My name is Seth, and I live with Parkinson's. Today, I'd like to talk about things that you should probably not say to Parkinson's patients. But before we start, remember to hit the follow and like so we can continue to spread the awareness of Parkinson's into the Parkinson's community. So, with that being said, let's get going. The first question or comment that I've been asked by a family member is, hey, how are you feeling today? Are you getting any better? Well, that person actually did not do any type of research or truly understand the, the way that Parkinson's is. Parkinson's is a degenerative disease. No, I'm not going to get any better. There's no cure for it. Yes, the DBS has definitely relieved some type of pain and symptoms temporarily, but eventually it's going to go back to where I was before. So, if you know anybody with Parkinson's and you truly do care and want to help that individual, just do some research. Understand it before we ask any questions like, are you getting any better? Another comment is they say, well, it could be worse. Well, yes, you're right. But again, what you're doing by asking that or saying that question or comment is you're invalidating our thoughts, our feelings, and our pain. So probably be best not to ask or say that. Another one is you're too young. Well, again, you need to understand that Parkinson's doesn't care about your age, your race, your gender, or any other factors. It hits everybody based on either genetics or chemical exposure or traumatic brain injury. So when you say that you're too young, again, you're not truly understanding the disease in itself. Probably should not be said. Another thing is, you can still live a long life. People make comments like this, generally thinking of Michael J. Fox and how long of a life that he's living. We are fortunate enough to have Michael J. Fox into our lives to understand and this disease, and also for his support and to research and possibly a cure. But you also need to remember that it's not about how long of a life you're living. It's about the quality of life that you're living. And right now, with people with Parkinson's, you can go from stage 1 to stage 5. And obviously stage 5 is the worst. I would rather have a better quality of life than anything else. So just remember that. And the last one is, well, you don't look sick. I was at a symposium and I actually had a female sitting at my table, and I know that she had a very rough time getting Social Security benefits because of this reason, but we don't necessarily know any of her symptoms. I don't know her symptoms. She doesn't know my symptoms unless we verbally say it to one another. So with the items that I just listed, just remember that the best way to deal with this is to be as normal as you could possibly be. Treat that person with compassion and understanding. Treat that person as if the way that you would like to be treated, the way that you would treat your wife, your spouse, your kids. Just be normal. When I go down the street or if I meet somebody and I realize that that person has any type of exterior deformities, if the person is an amputee, if they tell me that they have cancer or a tumor or anything like that, that's fine. I absorb the information, and then I treat them like a normal person. And close friends or relatives, I look into the disease so I can understand it a little bit better, so that maybe we could talk about something later down the line and be a little bit more sensitive to any of their feelings, the way that if they're feeling any pain, their medication, just to understand that person as a person. That's all we want. So with that being said, thank you for listening. Please remember to like and follow. Please remember also to be safe, be smart, and be strong. God bless.